Yes, and first of all, I'd like to welcome you to my debate. So, as you all know, we had to pick a debate topic for this class, starting at the beginning of our class, and then building it on throughout the course. So, for my debate topic, I chose Should We Medicate Children with ADHD? My name is Colin Donahoe. I attend Eastern Florida State College, the online campus at this time, and we are in PSY 2014-01Z. So what we'll be looking at today in relation to the topic, the table of contents, I will be talking about my relation to ADHD, going as far as defining it, and then going into treatment methods, into particular the medication, and then what are some alternative methods of treating children with ADHD, and then the outlook and prognosis. So I have a stance to this debate topic. Should we medicate children with ADHD? And in my belief, children with ADHD should not be medicated unless the medication is the only thing that works for the child at hand. ADHD is very individual. There are 3 types of ADHD, and medication can affect the child in a good way, positively, or in a bad way, negatively. But it really all depends on the child, as it is case by case. Just say no to ADHD meds. It's that simple. However, how did I build this stance? Why am I against medicating children with ADHD? So it starts at a young age. There's my relation. So in school, from a young age, I excelled. My reading level was above average. I was doing well in mathematics. I was in the gifted and talented program. However, when my sister entered school, my younger sister, it was not the same case, unfortunately. So instead, she had severe dyslexia, which meant there was letters and numbers jumping around the pages. So when she would do math problems, the numbers would be jumbled around, looked backwards and whatnot. And then when she would read, the letters and words would do the exact same. So unfortunately, she wasn't able to focus in school. So at age 5, she was diagnosed with ADHD, and she was placed on Adderall. And we'll get more to what Adderall is later, along with a little extra assistance in the classroom, which isn't a bad thing. A little extra help can go a long way, especially for children with ADHD. And then as she grew older, Donahoe, my sister, I began to see her to zone out. She wouldn't eat as much, and she just wouldn't sleep at night. So zoning out, I would talk to her, and she just wouldn't be able to focus. The same for my parents. She wouldn't eat dinner, she wouldn't eat breakfast, she wouldn't eat lunch. And in the middle of the night, she would stand in the middle of my doorway, because I used to sleep with my door open when I was little, and just stand there and look at me. Because she wouldn't be able to sleep, she wouldn't be able to focus, because of the Adderall. And then, as she grew older, my sister realized that she was different when she was off medication. So my parents wouldn't put her on medication on the weekends, because they also wanted her to be herself, and they did notice a difference. And then that eventually pushed my parents over the edge where they wouldn't make her take the medication along with her refusal. So by age 10, she was unmedicated, so this is all in 5 years. And only had some extra assistance in school, which isn't a bad thing like I mentioned before. And she was placed on an IEP, which is an individualized education program. So what is ADHD? What is the definition of ADHD? We're looking at it from a broad aspect, not from the DSM-5. We'll be looking at that later. So ADHD means attention deficit hyperactive disorder. It's a neurodevelopmental condition that is marked by hyperactivity, attention, and impulsivity. So remember, there are 3 types that are marked by 3 different things: hyperactivity, inattention, and impulsivity. So they can have either or, a mixture. It really all depends, as ADHD is an individual case-by-case basis. So we have hyperactivity on the left, and attention to the right, and then impulsivity. And one of the most common neurodevelopmental conditions in children, it happens quite a lot, of course. And then it's usually diagnosed in one's early childhood and can stretch into adulthood. So like my sister, she was diagnosed at age 5. So it's usually the elementary school years where teachers kind of realize what's going on with their students and then can kind of pick out who has ADHD and who needs some extra help, and then sending them to a specialist. And children can have trouble paying attention, being overly active, and controlling impulsive behaviors. They can't control them. They'll get up in class, loud outspurts, or they'll just lose focus and start drawing or scribbling on the desk or talking to others. And it's normal for a child to have difficulty focusing and behaving if they have ADHD. And then there are multiple symptoms of ADHD just from the broad aspect. There's daydreaming, having trouble getting along with others, so you might talk too much, make careless mistakes, have a hard time resisting temptation. It really all depends, and a lot of people can imagine how this would play out in a classroom, especially in the elementary school years. So what are the hardcore facts, ADHD and the DSM-5? So for the DSM-5 to be diagnosed, you have to meet 3 criteria within the diagnostics. The DSM is like the Bible for people who are in this field, especially with psychology in general, looking at therapy, psychologists, and whatnot. So ADHD is listed as 5 criteria, but remember they only have to meet 3. So for A, they have to have a pattern of inattention or hyperactivity or impulsivity that interferes with functioning or development characterized by inattention and hyperactivity and impulsivity. B, several inattentive or hyperactive impulsive symptoms were present prior to age 12 years. So remember, ADHD is looked at when you are in elementary school, or one is in elementary school, so the teachers can kind of pick who has ADHD and whatnot before middle school and high school. So there usually is a diagnosis before then. There's also several inattentive, hyperactive, impulsive symptoms are present in 2 or more settings. So that could be at home, that could be at school, that can be out in public. It really all depends. There's clear evidence that symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So like in my sister's case, she couldn't focus in school. So that interfered with her academic functioning. And then the last one that one has to meet, the symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder and are not better explained by another mental disorder. So it has to be exclusive. So remember, one only has to meet 3 out of these 5 criterias, either 3 out of A, B, C, D, or E. And what are some treatments for children with ADHD? What does one suggest when treating this condition? So there are 2 types of medications that one can be put on. There's central nervous system stimulants and non-stimulant medications. There's also psychotherapy, which is used to get a child to open up about their feelings, like why couldn't they focus and whatnot, but the therapist will prod around to figure this all out. There's behavioral therapy, which teaches a child how to monitor their behaviors and change them when appropriate. So if a child is wiggling around in their seat, a child will be able to know to switch their behavior because they're wiggling around and it's not appropriate. There's also social skill training, which is how should a child act out in public. That's where children that need a little extra help, where that can weigh in. And then there's also support groups. So especially when you're placed on an IEP, there's multiple children that go to a special program. They could talk about how they deal with ADHD or if they have autism or depression. It's a real good mixture, but especially it's going to be for those who are challenged educationally and academically. So what are the medications that treat children with ADHD? Remember, there are 2 main groups. There's central nervous system stimulants and non-stimulants. So your central nervous system stimulants help children focus and ignore distractions. They increase neurochemical levels in the brain, where attention, focus, and planning take place. So it's going to help the brain map out where they need to go next and whatnot without getting distracted or whatnot. And there's 2 categories. So there's Ritalin and Adderall, your methylphenidates, and your amphetamines. Ritalin works sooner and reaches climax quicker, but Adderall has a longer duration of activity in the body. It really depends on what the child needs. Does the child need something that's going to work right away when they take it, or it's going to last throughout their school day so they don't have to take multiple doses? Then for our non-stimulants, it is prescribed if the stimulants do not work. It's almost like a last resort type of deal. There's not much research, as they do not have to be FDA approved like your central nervous system stimulants do have to be. The 3 approved medications are listed right there. So what are some side effects from ADHD medication? For every said medication, there is going to unfortunately be side effects. So there's your regular side effects like loss of appetite, dry mouth, and irritability. And then more severe effects include addiction, psychosis, Raynaud's syndrome, which is reduced blood flow to the fingertips and toes, or even slowed growth in children. So why should we not medicate children with ADHD? What really goes on? Why do I believe that children should not be medicated? Medication can make a child zone out. As I learned with my sister, I would talk to her and it would be like talking to a wall. I wouldn't get anything in and I wouldn't get anything out. The child may not want medication, as my sister later refused the medication. It can take months, even years, of switching medications to find out what works. Some people switch between Ritalin and Adderall, and it's really rough on the body. The child will get used to certain rhythms that Adderall or Ritalin have, and then they'll switch the dosage. So they might lose effectiveness earlier in the day or later in the day, such and such. There are alternative treatments that can help children with ADHD, which I do side with. But there are exceptions of why we should medicate children with ADHD. The child needs to focus and is often acting out. Alternative treatment did not work. One is trying to lower a dose while using alternative treatment, so meaning that they are bridging their way into the newer treatment without medication, leaving medication behind. Or if the child is having severe withdrawal symptoms, which are not good either. So what are the alternative treatments for children? What can we really do so the children is not medicated? There's the cognitive behavioral therapy, which pinpoints behavioral challenges and develops various strategies on how to challenge them. So the child will talk to a therapist and say, hey, I can't really focus in school. The therapist will work on how to make them focus in school, like choosing something to look at, like on the chalkboard or something. Like, hey, there's a sticker. Look at this sticker when the teacher is talking. Easy peasy. There's behavioral therapy, which changes behavior through positive reinforcement and feedback, and establishing clear consequences for unwanted behavioral and being consistent with expectations. So a child may have an aide in the classroom, and the aide will determine, hey, you're acting out right now, we need to fix this behavior immediately, and if not, I'm not going to give you your sticker, or you're going to go to recess a couple minutes late. There's psychotherapy, which lets a child be open about their feelings, so open talk therapy. There's social skills training again. And then with therapy, there's exercise, which helps, nature therapy, meditation and yoga is a big one, and coaching. So like those little aids that come in the classroom to help the child, even like when they're on an IEP, do help. And those are your little superpowers in addition to the superheroes. The superheroes being therapy, and the superpowers being the exercise, nature therapy, etc. So the outlook and prognosis. If a parent chooses not to medicate their child or not have the child take the medication, there's a chance of it working. A child, when taken off medication, the child can then control their behaviors by themselves, along with a therapist or guidance counselor. They don't have to rely on the medication to help them out. They are in their own conscience, and they know right from wrong, and eventually they'll know how to control the symptoms of ADHD and learn to live with it. Even without medication, a child can be placed on an IEP, so the child can get additional assistance where needed, so like being sent to math help or reading help, or having an aide in the classroom. Then IEP is a secret weapon for children with ADHD, especially in school. However, the child cannot focus or function without the medication. The child needs to be placed on medication. It can even be on a lower dosage and start working their way of weaning the child off the medication. That can happen at later ages, so your late elementary school years, your early middle school years. So in conclusion, ADHD is a common condition among children, which can even stretch into adulthood. By adulthood, usually you will learn how to manage it. When a child cannot focus, they are put behind others, and sometimes people with ADHD take a tad bit longer to process information, and that is okay. Everybody has their own strengths and their own weaknesses. So like my sister had dyslexia, and that was in conjunction with ADHD. Nevertheless, a non-medicated route for a child with ADHD should be taken. I believe it doesn't hurt starting out, and then if one needs to put their child on medication, it is okay. Children with ADHD should not be medicated unless medication is the only thing that works for the child. It is all about the child at hand, not about anybody else, but what does work for the child. So one can remember that there will be obstacles, there will be doubters, but there will be mistakes, both hard work, there are no limits. And that is really comes to terms with children with ADHD. They want to get better, they want to be able to focus more in school. But what will they be able to do? What are the treatments? Medicating or therapy? I believe in therapy, some people may believe in medicating. But I do not like the side effects of medication and what they do to our children. And finally, the references are listed here. They are in APA format. So everything right there is an APA. I also did stick for my DSM-5, the citation right at the end. I really appreciate your time. Thank you so much for watching, and I hope you have a great winter break. Thank you.